Module 6, HIV/AIDS Prevention, Evidence-Based Recommendations. In this module, we will learn evidence-based recommended strategies for HIV/AIDS prevention. The effectiveness of these interventions have been established through carefully conducted randomized clinical trials. Evidence-based recommended interventions include prevention of sexual transmission, HIV counseling and testing, antiretroviral treatment and HIV prevention, role of harm reduction program in prevention of HIV transmission among people who get drugs, role of parent-to-child transmission, PPTCT, of HIV, voluntary medical circumcision, VNLC, role of safe injection practices and infection control, and safe transfusion and post-exposure and pre-exposure prophylaxis. HIV can be prevented and treated, but still there is no curative treatment available. The treatment is lifelong, and there is still no vaccine available to prevent it. HIV can be transmitted through certain body fluids such as blood, sexual and rectal secretions, and breast milk of infected mother. Multiple interventions are required for prevention of HIV transmission. HIV prevention strategies can broadly be divided into three types: prevention of sexual transmission, prevention of parental transmission, and prevention of vertical transmission. Sexual transmission means through sexual contact, including vaginal, anal, and oral. Parental transmission means through piercing mucous membrane or skin barriers, such as bleed-distinct injury, isolate barrier, isolation practices, cuts, and agreements. Vertical transmission means from HIV-infected mother to baby during pregnancy, labor, and lactation when mother feeds baby with her milk. Prevention of sexual transmission. Majority of people in the world have been infected through sexual transmission. However, in Pakistan, the predominant mode of HIV transmission is through injection drug use. Although sexual transmission of HIV is also quite common in our country, risk of sexual transmission varies from type of sex, such as anal sex is associated with higher risk in comparison to vaginal and oral sex. Efficiency of sexual transmission increases many times in presence of different STIs. Prevention of sexual transmission include consistent and proper use of condom, delaying sexual activity in adolescents, safe sex practices, avoiding exchange for sex for money or drugs, avoiding sexual promiscuity, monogamy, and abstinence, which means no sex. HIV testing and counseling is HIV prevention tool. HIV testing identifies HIV-infected individuals, and those infected can be linked to treatment and care and support services. WHO returns that every person who may have any risk factor to go tested for HIV. Therefore, we need to scale up HIV counseling and testing so that we achieve UNAIDS target of 95% of HIV-infected individuals who know their HIV status. HIV testing strategies. There are different HIV testing approaches depending upon type of population and situation, such as voluntary counseling and testing, which is known as VCT, care provider initiated HIV counseling and testing, antenatal HIV counseling and testing, community-based HIV counseling and testing, and self-testing. Antiretroviral treatment as prevention tool, TASP. Scientific data suggests that people living with HIV who are on ARP and then fully adult means that take medicine as advised, achieve very low which is undetectable in those patients, chances of the HIV transmission are most zero. It is necessary to start the RP as early as possible, immediately after diagnosis, and ensure complete adherence. WHO recommends that at least 90% of people who know their HIV status should be on ART. Harm-reduction programs for prevention of HIV among people who inject drugs or PWIDs. Harm-reduction program to decrease vulnerability of PWIDs for HIV has proved very successful in different countries. It's being implemented in Pakistan in 58 districts of the total 180 districts in the country. Harm reduction program is a package of services provided to PWIDs through trained outreach workers. The services include education, counseling, HIV testing, antiretroviral treatment, needle injection program or NSP, detox, opioid substitution therapy, and rehabilitation. Prevention of parent-to-child transmission of HIV, what is PPTCT. Antiretroviral treatment of HIV-positive women reduces the chances of HIV transmission to her baby, mother-to-child transmission. Considering mother-to-child transmission a shared responsibility of both parents, Government of Pakistan is implementing Prevention of Parent-to-Child Transmission Program, PPTCT. PPTCT program includes timely diagnosis of HIV in pregnant women, such as antenatal HIV testing, antiretroviral treatment, safe birthing space, and family planning. Voluntary medical male circumcision or VNMC. It is proved that male circumcision reduces risk of HIV transmission by 60% in heterosexual men. Male circumcision involves removal of foreskin, the tissue covering head of penis. Male circumcision more probably reduces the risk of HIV transmission because the area under the foreskin is easily stretched or torn during sex and provides dark and moist environment for HIV virus to thrive. Structural interventions for HIV prevention. Structural interventions require altering aspects of social, political, economical, or legal environment to promote positive health-related behaviors. Effective policy on legal changes like laws and regulations. Enabling environment changes, that means the empowerment of key population. Shifting harmful social norms. Empowering communities and groups like women, key population empowerment. Self-injection practices, infection control and prevention, and screening of blood before transfer. Avoid unnecessary use of injection and equivalent of oral medication. Never reuse syringes and needles. Develop and implement comprehensive plan for safe and appropriate disposal of used syringes and hazardous waste. Ensure implementation of infection prevention control program at health facility and community level. And ensure screening of blood before transfusion and promote voluntary blood donation. Pre-expert prophylaxis are PrEP and post-expert prophylaxis are PEP are important HIV prevention interventions. They will be covered in module antiretroviral therapy.